Most people assume that every medical test is a good idea. But what if I told you that past a certain age, some of those tests can actually put your life at risk? It sounds odd, I know. Yet the reality is that not all blood work, scans, and screenings are harmless. In fact, a few of the most common checks offered to older adults can trigger false alarms, needless stress, and even dangerous procedures. This isn't scaremongering. More and more physicians, especially those who treat patients over 70, are acknowledging the problem. Medicine is slowly waking up to a new truth. The one-size-fits-all approach falls apart in late life and can do real harm. In this video, we'll take a candid look at 5 specific medical tests seniors might be better off skipping. The various screenings seasoned doctors often refuse for themselves. We'll explain why these tests are pushed so hard, the hidden downsides they carry, and the safer alternatives that deliver the information you need without the risk. You deserve healthcare that respects your age, your body, and your quality of life. If you care about staying healthy but don't want to become a casualty over treatment, pill overload, or an overwhelmed system, this video is for you. We're not here to scare you. We're here to give you knowledge, confidence, and a clear sense of what truly supports health after 70. Let's get started. Mistake number 1. The colonoscopy trap. For decades, colonoscopy has been hailed as the gold standard for preventing colon cancer. Yet after age 70, especially if you have no symptoms or family history, the test can bring more harm than help. What once saved lives in our 50s and 60s can, in later years, become a source of risk, stress, and even hospitalization. Why colonoscopies get riskier as we age. A colonoscopy is never a light procedure. You have to flush out your entire bowel, take sedatives, and have a scope threaded deep into your intestine. That's challenging for younger adults, and the stakes climb sharply in older bodies. The bowel prep alone can leave seniors badly dehydrated and throw off their electrolyte balance, each of which is dangerous at an advanced age. Sedatives hang around longer, so confusion, dizziness, and unexpected falls become far more common. On top of that, the test often finds tiny polyps, slow-growing spots that might never cause trouble. Yet once discovered, they're usually removed, because these lesions can take 10 to 15 years to turn cancerous. Many people in their late 70s or 80s won't live long enough for them to matter, but they still face the risks and stress of follow-up care. Fear kicks in the moment a small polyp shows up, setting off biopsies, repeat scopes, and sometimes partial bowel resections. When the odds of complications outweigh the benefit, prevention turns into harm. I'll never forget George, an active, sharp 82-year-old who agreed to a routine colonoscopy with 0 digestive complaints. During prep, he became badly dehydrated. After the procedure, he was lethargic and disoriented. That night, he fell at home and broke a hip. One test led to months of rehab, major costs, and enormous stress, and the scope found nothing. This isn't about blaming doctors. They follow the training they receive. Medicine, however, evolves, and we must evolve with it. If you're over 70 and symptom-free, it's perfectly reasonable to skip a colonoscopy. Today, we have non-invasive stool tests that are safer, simpler, and in many cases, informative enough. We need to weigh the true cost, physical, emotional, and financial, of subjecting aging bodies to procedures that may offer no benefit. More testing doesn't always equal better care. After 70, less intervention and smarter choices often keep us healthier. Caution isn't neglect, it's respect for your well-earned years. Mistake number 2, falling for the annual full-body scan. The idea sounds irresistible. Step into a high-tech scanner and let it search your body from head to toe, catching every threat before it strikes. Smart prevention, right? For people over 70, that promise can turn into a curse. Instead of adding years to your life, an annual full-body CT or MRI often triggers a chain reaction. Fear, extra tests, needless surgeries that may shorten life rather than extend it. Why a full-body scan backfires after 70. Full-body scans are powerful tools, but they capture everything. including harmless quirks your body has carried for decades. These incidental findings become ticking mental bombs. A tiny nodule here, a faint shadow there, and suddenly you're swept into a whirlpool of specialist visits, biopsies, and follow-up scans, all aimed at something that might never have threatened you. As we get older, the downsides of these tests grow. A procedure that felt like a simple checkup at 45 can in later years lead to complications such as infections, a collapsed lung, or an extra long recovery. Even lying perfectly still in an MRI tube can be painful when you have stiff, arthritic joints. There's also the mental strain. Instead of enjoying the health you do have, you start worrying about every maybe the scan uncovers, and it rarely stops at one scan. Each new abnormal finding can set off a chain of extra appointments, higher bills, and more stress on a body that's already taking longer to heal. A cautionary tale. Mary Thompson, 78, was active and felt perfectly fine. She walked every day and had no complaints. At a local health fair, a mobile clinic advertised a discount full body scan. The scan showed a tiny spot on her kidney that was probably harmless, but seeing the word mass in the report still sent her into a panic. Within a month, she was in surgery, followed by months of rehab, exhaustion, and lingering complications, all for something that likely would have never caused trouble. Medically, it was classic overdiagnosis. Emotionally, it stirred needless fear. Financially, it was costly. Full-body scans are rarely covered by insurance, so seniors often pay out of pocket for what turns out to be borrowed peace of mind. And once you're on that medical conveyor belt, it's hard to step off. Once you're past 70, it's smart to be selective about medical tests. Trust your body a little more, and focus on real symptoms instead of every tiny blip a scan might show. Not every faint shadow deserves your worry or your cash. Team up with your doctor to stick to focused, proven tests that fit your personal risk factors, instead of signing up for catch-all screenings. If you're still watching and this resonates, drop number 2 in the comments so I know you're here. And if you haven't subscribed yet, tap subscribe and the bell so you won't miss future videos. Your support lets us keep making practical, inspiring content. Now let's move on. Number 3. The problem with using over-cardiac stress tests. For decades, the treadmill stress test has been a staple for spotting heart disease, especially in older adults. The logic seems clear. Push the heart, then see how it reacts. Yet after age 70, that logic can turn against you, and many seniors find out too late. What was helpful in our 50s or 60s can become questionable or even dangerous in later years. Why? Stress tests in older people often spit out false positive results. Doctors warn the printout shows a problem even though the heart is fine. This happens because aging bodies change naturally. Arteries stiffen, blood pressure swings more, the heart's electrical patterns shift. The machine can't tell normal aging from real disease. It flags an abnormality and kicks off a long chain of follow-ups. What comes next? Angiograms, catheterizations, sometimes even a stent or bypass surgery. Each step carries real dangers for seniors. Bleeding, kidney damage from contrast dye, sudden blood pressure crashes, slow surgical recovery. A harmless treadmill can end at a hospital bed. I remember one case clearly. George, 74, a retired bus driver, felt great. No chest pain, no shortness of breath. During a routine checkup, his doctor ordered a stress test just in case. The result was borderline, so George saw a cardiologist. 3 weeks later, he had an angioplasty for a blockage that had produced 0 symptoms. A month after that, he had developed a severe catheter site infection, landed in intensive care, and spent 6 months in rehab. His quality of life never fully returned. Was that treadmill worth it? More leading cardiologists and geriatric groups now advise against routine stress tests in symptom-free seniors. They agree, if you don't have chest pain, breathlessness, or unexplained fatigue, the test adds no benefit and real risk, especially if your goal is quality of life, not endless procedures. Yes, emotionally, we all want to check the heart. It's the rhythm of life, our very core. But healthy aging isn't a hunt for every potential blip. It's listening to your body, staying independent, and steering clear of extra medical steps that can take more than they give. This doesn't mean ignoring heart health, far from it, but instead of racing on a clinic treadmill, focus on the basics: daily walks, balanced meals, social connection, and stress control. Those give your heart more than any test. What truly supports the heart after 70 isn't machines, wires, or exams built for people half your age. It's discernment, the courage to say no just because it's available. Wisdom is knowing that not every test is a gift, and sometimes skipping one is the most life-affirming choice you can make. Mistake number 4. The hidden dangers of routine colonoscopy. Colon cancer is frightening because it often develops quietly. That's why colonoscopies have been promoted for years as an essential safeguard. But after 70, the calculation changes. In many cases, the risk now outweighs the benefits. Every colonoscopy starts with sedation. Yet, an older liver clears drugs more slowly and an aging brain reacts more sharply. Confusion, memory lapses, and lingering brain fog can linger for weeks. The bowel prep is tough. Drinking strong laxatives frequently leaves seniors dehydrated, depletes electrolytes, strains the kidney, and drains energy. One dizzy moment on the way to the bathroom can lead to a serious fall, especially for someone who lives alone. The payoff also shrinks with age. Colonoscopies look for polyps that usually need 10 to 15 years to become cancerous. If previous scopes were clear and you're now in your 70s or 80s, the odds that a new polyp will ever threaten you are tiny, while the chances of complications, bleeding, perforation, or adverse drug reactions keep climbing. Consider Mary, a 78-year-old retired teacher. She'd had clear colonoscopies at 68 and 73, but her doctor suggested one more just to be safe. During that exam, her bowel was perforated, a rare yet very serious mishap. Emergency surgery and weeks in the hospital followed. Mary survived, but her energy and independence never fully returned. She now says, "If I had known the test could cost me this much, I would have skipped it." Why does this still happen? Medical habit. A test that made sense at 50 often gets repeated at 75 by default. Meanwhile, fear of cancer can overshadow what matters more at this stage: staying mobile, thinking clearly, and feeling emotionally balanced. No screening, however advanced, is worth surrendering those foundations for a slim chance at a few extra years. A better approach is to stay alert for genuine red flags, such as unexpected weight loss, persistent abdominal pain, or blood in the stool. In those situations, a scope is reasonable. But if you feel well and earlier results were clear, another routine colonoscopy may add risk without real benefit. Take back control by weighing the trade-offs instead of saying yes simply because it's the norm. Your body deserves care that matches your stage of life, not risks that no longer bring a fair return. If this information helped you, type number 4 in the comments so I know you're with us. And to catch future videos, hit subscribe and turn on notifications. Your support lets us keep producing valuable, uplifting content. Number 5. The pitfalls of routine cardiac stress tests. Heart disease feels like a ticking time bomb. We constantly hear stories of someone who seemed healthy one day and suffered a sudden heart attack the next. It's only natural to want to catch everything early. That's why cardiac stress tests, whether on a treadmill or with a drug-induced workload, are so widely offered, especially to people over 70. Yet here's the surprising truth for many older adults, particularly those who have no symptoms. These tests often do more harm than good. In theory, it sounds reassuring. Walk on a treadmill, record the heartbeat, and if something looks off, fix it in time. Reality is messier. Stress tests can mislead once you're past 70. Normal aging stiffens arteries a bit, leaves small cholesterol spots, and slows recovery after exertion. A treadmill or drug-induced test may read these ordinary changes as heart trouble and set off a string of follow-ups. An abnormal result often leads to angiograms, catheterizations, stents, or even bypass surgery. Each one bringing real risk for older bodies, like bleeding, kidney damage, or contrast eye, sudden blood pressure drops, and long recoveries. In many cases, the treatment targets mild, stable plaque that would never have caused real problems, and the procedure itself ends up hurting quality of life. A cautionary story. Frank Miller, 76, lives in a quiet suburb outside Columbus, Ohio. He walks every day, plays with his grandkids, and has never felt a hint of chest pain or shortness of breath. At his annual physical, his doctor suggested a just-in-case stress test. A tiny irregularity popped up, so Frank was sent for a heart catheterization. The procedure showed a few small plaques that weren't blocking blood flow, but a stent was implanted anyway. Complications from the blood thinners followed: internal bleeding, a hospital stay, and a 3-month recovery. All of it started with a test he never really needed, and a problem that wasn't urgent. Why does this keep happening? Fear is a big driver. None of us want to overlook a hidden threat, but after 70, quality of life should matter more than stacking up procedures. Energy, independence, and everyday comfort often outweigh the hunt for issues that might never cause trouble. That's why many leading cardiologists now advise against routine stress tests in symptom-free seniors. Studies show these exams don't cut heart attack risk or improve survival when there are no real warning signs. For people who feel fine, no chest pain, no breathlessness, no unexplained fatigue, stress tests aren't just unhelpful, they can be risky. A smarter strategy? Pay attention to genuine symptoms. If exercise leaves you unusually tired, brings on chest pressure, or throws your heartbeat off, get checked out. But if you're sleeping well, staying active, and feeling steady, trust what your own body tells you. That feedback is often more reliable than any machine. Healthy aging means swapping aggressive interventions for thoughtful observation. It's not neglect, it's a wise living. The goal isn't to chase every possible disease, but to safeguard your time, clarity, and dignity. Growing older does not mean becoming helpless. On the contrary, it's the season for questioning the system, slowing down and asking yourself honestly, do I really need this? In a world that celebrates tests and pills, sometimes the boldest choice is to do less. Not out of indifference, but from a deep understanding of your body, your values, and your aims at this stage of life. Medicine after 70 shouldn't be an assembly line of automatic procedures. It should be a conversation about what matters to you, how you want to live, and which risks you're willing to accept or decline. Blindly following protocols designed for younger patients can steal energy, peace of mind, and even years of life. Not because doctors wish you harm, but because the system is built to fight disease, not to honor well-being. If this video prompted fresh thinking about your health, then it's done its job. Remember, saying no to a test isn't ignoring your health. It's weighing benefit against risk. Not every scan brings clarity. Some lead into a maze of repeat testing, anxiety, and needless treatment. Take ownership. Talk openly with your doctor. Ask questions. Voice your priorities. Real healthcare isn't just running tests. It's respecting your life. Ask whether a test will truly change the outcome or merely pad the chart. Consider your time, energy, and comfort. They're priceless at this age. You've earned the right to live on your own terms, without fear, but with understanding, not overloaded by procedures, but empowered by knowledge, not bracing for illness, but building a life rich with purpose, joy, and the warmth of loved ones. Thank you for being here today. Share one takeaway from this video and how you plan to use it. Your comments inspire us. If you found this video helpful, please like, subscribe, and share it with your friends. Your support enables us to keep creating meaningful, uplifting content. Thanks for watching, and we'll see you in the next video.